So hi everyone, my name is Emma Hayes. I'm going to be going off a little bit about what Taylor said about the mental health aspect, especially for women who have AMN. So, sorry, I never cry, but I might get a little emotional because this stuff just happened. So when I think of suicide, I don't ever really think of someone, I think of someone hanging themselves or cutting their wrists open. I don't really think of someone downing a whole bottle of prescription pills that are supposed to help them. Yet, this is what my mother did a little less than 2 weeks ago. Thankfully, she was not successful, but she came very close. To say that this has shaken my family would be an understatement. I cannot describe to you the types of emotions that I have experienced these past 2 weeks. So my mother has AMN. She's 50 years old now. Most people think that only men are affected, but we now understand that women can have very serious and debilitating symptoms too, like my mom. Symptoms vary from person to person, so I don't want anyone here to think that you might develop any or all the symptoms she has, because it really does vary. Just to name a few of her symptoms, she has extreme difficulty walking and now spends the majority of her time in a wheelchair. She doesn't have control over her bowel or bladder and suffers from hair loss, poor skin complexion, and restless leg syndrome. She's pretty much housebound at this point. These symptoms started about 10 years ago and were mild at first. However, in the past 4 years, they have become progressively worse. At first, my mother did not let on how the symptoms were affecting her emotionally and physically. She continued to try and plow ahead, but slowly things started giving way. She stopped driving and began to go upwards of 2 weeks without leaving our house, despite prodding from everyone in our family to get out. And for those of you who know my family, my mom has 4 siblings, and they're very involved. We always say, people are there all the time, whether you like it or not. So it was really difficult for them to see too, what was happening to her, because they would go over all the time and try to get her to go out and do stuff. And she continued to tell us that things were fantastic and she had nothing to complain about and she was living the dream. But in reality, she was suffering and we didn't know. In the last year, she's become extremely depressed at times. She would never let us know how bad this was, though. My father, sister, and I have tried to help her by setting up appointments with therapists, which she canceled every time. My sister and I have come home every weekend from college to be with her, which helps, but only for a short time. And then we're back to the stupid fights, the depression, and her stubborn attitude of not needing help from anyone. So my mother has a really tight-knit family, like I said before, and they too felt frustrated and helpless. Over the past 2 years, I've become numb to the effects that my mother's disease has had on my family. The cycle of emotional ups and downs has been going on for so long that I just thought, it's just mom, she'll be okay. The reality is, though, that when you spend your whole life taking care of other people, being the president of PTO, working full-time, and being super mom, and then all of a sudden this is taken away from you, you won't be okay. Her world was turned upside down, and she didn't know how to ask for or accept help from anyone. Suicidal and depressive thoughts are not always wanting to kill yourself. They're sometimes giving up and not wanting to take care of yourself anymore because you don't know how to. It's not due to a lack of support or love from family and friends. It's thinking that you have no purpose in life. Sorry, I lost my place. And people would be better off without having to take care of me, a saying I've heard quite a few times in the past year. My mother has taken care of others her entire life. She was a stay-at-home mom for the second part of my childhood, and her purpose was caring for her family. So when my sister and I left for college, she found it difficult not having us there to take care of and not cooking for us, because she's an amazing cook. Some people know this. She cooks 5-course meals for us sometimes. And she struggled to find a new purpose in her life. Her inability to leave the house, along with her other AMN symptoms, magnified her loss of purpose and worsened her depression. My mother made an impulsive decision when she took an entire bottle of pills. I'm not sure if she actually intended to kill herself, but what I do know is that she's been unhappy for a really long time. When my dad found her, my mother had aspirated on her own vomit and was unresponsive. She was rushed to the hospital and intubated in the ambulance because they thought she was going to die right then and there, determined to have aspirated pneumonia because of her overdose. We discovered when she got to the ER that she had other medical conditions going on, such as a urinary tract infection, which led to a blood infection that she, again, never told us about because she didn't think that it was an important thing. She was in a precarious medical state for days. Even after the breathing tube was removed a few days later, she was not herself mentally or emotionally. It's almost 2 weeks later, and she's starting to get better physically. There's a lot of work that she will have to do to get emotionally and mentally better, but I really do think that she wants to try. She sees how scared we all were and wants to put in the effort to get better. Multiple doctors and nurses have reminded her that she would be dead if she did not have people who cared about her so much. My mother will have spent more than 2 weeks in the hospital by the time she is released because of her pain and untreated depression. Her journey towards recovery is far from over. She will soon go to a physical rehabilitation hospital and will be spending at least a week there. When she is released from rehab, she will have to complete mandatory intensive outpatient psychiatric sessions almost every day of the week, which will continue for who knows how long. I don't blame my mom for what she did, but I really wish she had let us know how bad things had gotten. She has a million people who care about her and only want the best for her, and any one of them would have dropped whatever they were doing to help her. However, depression does not let you see this. Depression only promotes the bad, the feelings of worthlessness and sadness. Many times people with chronic diseases think that their physical symptoms are more important than their mental ones, but this is not true at all. Mental health is as important, if not more than physical health in instances like these, given that many women, especially with AMN, think that men should have it worse off, or that they do have it worse off, and they don't want to seek help because they feel guilty about that. The past 2 weeks have been ridiculously difficult, but I'm hopeful that things may finally start to get better. I'm telling you, you don't want to be in the same situation that my family has been. You don't want your kids visiting you in the intensive care unit on your 50th birthday, bringing you one single freaking sunflower because you're on suicide precautions and the hospital won't allow you to bring anything else in. You don't want your husband sitting by your bedside day and night because he doesn't want to leave you alone, blaming himself for what happened to you. You don't want your elderly mother, who also has AMN, visiting you every day, hoping and praying that you'll come out of this stronger and that you'll be better. I'm telling you from firsthand experience, you and your family don't want any of this at all. So I implore you, if you feel sad or lonely or depressed, please seek help. My family is in a world of hurt, confusion, and sadness right now, and we have a really long road to recovery ahead for all of us. There's no judgment or stigma around mental health or depression. I think as women, we often bury things and convince ourselves that we're okay and don't need medication or psychiatric help. I promise you, there's so much less judgment around it than you think, and people honestly don't care if you're taking medication or not. Everyone takes medication for something. It's really not a big deal. So if you do feel sad, tell someone how you're feeling. My family had an extremely close call this time, and I seriously hope this will never happen again, but I know the depression won't go away. If anything, it's been a major wake-up call for us about the importance of mental health, especially for people like my mom who have AMN. If you take one thing away from what I've talked about today, I genuinely hope that it's that you can realize it's okay to admit when you're not okay. It's okay to ask for help, and that's the first step. Reach out to fellow AMN patients, reach out to your family, your friends, but please don't bury your feelings. Everyone in this room will probably talk to you and not be judgy about how you're feeling. It's okay to talk to anyone here. No one's gonna say that your feelings are invalid or bad. And I almost guarantee that there's at least one person who would be extremely sad if you weren't here anymore. Thank you.
Thank you so much, Emma, for sharing such a powerful story and for your bravery in coming forward to share this with us so soon after dealing with it yourself. I think it's pretty remarkable to look back at the 3 stories we just heard and see how, as much as at this conference we talk about the physical symptoms of ALD, the patient experience is about so much more. It's about your attitude towards ALD. It's about your relationships with your family, your emotions, your mental health. So with that thought in mind, we're going to move into our breakout sessions.